Hi, I am Neha Patel and I'll be presenting the Agency for Healthcare Research and Quality, also known as AHRQ. I will first discuss who they are. They are the lead federal agency in charge of improving safety and quality of the American healthcare system. They develop the knowledge, tools, and data needed to improve the healthcare system and inform those who make decisions about the system. AHRQ was established in 1989 and was originally named Agency for Healthcare Policy and Research. Their mission was to improve the safety and quality of healthcare by facilitating and funding research. In 1999, Congress changed the agency's name to now what we know today. Since 1999, the mission has been to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable, and to work within the United States. To achieve this, AHRQ has three core competencies. The first being healthcare research. They invest in research on how to make a better and safer healthcare. The second is practice improvement. They create strategies to help healthcare professionals and the healthcare system improve. And lastly, data and analytics. They create data to help decision makers understand the system and where there needs to be improvement. There are three areas the AHRQ focuses on. One being they focus not just what part that needs improving, but how to make it better and following through with it. Two examples of this are Project ECHO and Project RED. ECHO stands for Extension for Community Healthcare Outcomes. They focus on supporting and training primary care clinicians in rural communities to provide specialized care for their patients. Some issues that rural areas face are hepatitis C, mental health, substance abuse, and HIV. Project ECHO was also adapted by the Veterans Health Administration to expand higher quality care for veterans. And Project RED helped hospitals rework their discharge process to reduce readmissions by determining patients' needs and carefully designing and communicating discharge plans. From 2018, hospitals have seen a 30% reduction in hospital readmissions and emergency room visits. Another area of focus is that AHRQ creates materials to teach and train healthcare systems and professionals to put the results of research into practice. And three examples of this are Evidence Now, Comprehensive Unit-Based Safety Program, and Team Steps. Evidence Now is aligned with Million Hearts with the goal of improving the heart health of millions of patients, and CUSP is a method of preventing healthcare-associated infections. Because of CUSP, ICUs were able to reduce those bloodstream infections by 41% in 2018. And Team Steps was developed with the Department of Defense. It is a free training program designed for healthcare professionals to improve patient safety, communication, and teamwork. In 2018, AHRQ has trained more than 1,500 organizations and will continue to do so by sharing the training tools with the Centers for Medicare and Medicaid Services. The last area of focus is generating measures and data used by providers and policymakers to better the healthcare system. Two ways AHRQ generates the data is from consumer assessments, which provide valid assessments of patients' experience of care in hospitals, nurses' homes, and doctors' offices, and the Healthcare Cost and Utilization Project that highlights the jump in hospitalizations among those Medicare, Medicaid, and private pay patients for overuse of opioids. From the data, they were able to launch an initiative to reduce opioid abuse in 2015. These are just some of the examples on how the Agency for Healthcare Research and Quality has improved the healthcare system and will continue to do so in the future. These are the two sites I've used for this presentation. Most of the information I have gotten from their website themselves and the history from researchamerica.org.